I am here with Karen, and we are going to talk about her ketamine experience. In the realm of mental health, ketamine is a device or a molecule that we use for neuroplasticity. And what that means is that it helps your brain think, work, move in a different way than it did before. This is really useful for long-term patterns and habits that we have developed over time. Like we have a response to something, somebody says something to you, you have an immediate response because you've already been in the situation. Neuroplasticity allows you to take that step back and say, do I want to respond in this way, or would I like to do things a little bit differently? And then often when we have that moment, we are able to process things better, have better relationships, and then deal with our own issues, depression, anxiety in a more healthy way. So let's hear from Karen. What led you to want to do ketamine?
It just felt like intuitive. Like I just knew I wanted to do it. And I just want to be clear, I don't like to feel altered. I don't like it with alcohol, I don't like it with anything, but I knew ketamine was something I needed to do for me.
Okay.
And I really wanted to get deeper into my behavior, my kind of, patterns that I created probably from childhood. I'm always trying to uncover deep places in myself that aren't serving me. So I was hoping for that. And so, yeah, that's what made me want to do it.
Wonderful. We want to walk through our appointments a little bit. So it starts with, we do medical clearance with me, and you've been a patient of mine for a long time. So that was relatively easy. There's about 8 contraindications or reasons that we absolutely will not do ketamine for people. And then, a variety of other ones that will make it not the best treatment. And so from a medical standpoint, Karen didn't have any of those issues. So then I cleared her for that. And then you met with Nicole and you had a conversation with her, and tell us about that.
Well, I really felt safe with her. I mean, she is a wonderful person, and I just really felt this confidence in her ability, and I felt like she understood me and had this incredible feeling of safety with her. So, and it was a really great appointment, great experience just to be heard.
Yeah. Yeah, she is amazing. She's a great listener and so empathetic. And that appointment covers kind of like what has happened up to this point, like what has led the patient, Karen in this case, to want to make some changes in their life. So it could be childhood trauma, long-term things that have happened, recent things that have happened, traumatic events, whatever it might be. That appointment is designed for that, to get to the root of what is happening so that Nicole has a good idea of what's the best way to get to that and heal that trauma, those difficulties in the life. And then the next appointment is right before the ketamine infusion. And tell us a little bit about that one.
This set and setting appointment?
Yes.
Yeah. So we went over what music I would want to listen to, would I want to have would I want to be laying down, would I want a blanket, just all these things for set and setting to just make me feel really safe, comfortable, and at ease. We really went through what music to listen to because music was really impactful. So I really wanted to find the perfect music, and we went through various kinds of music. So that was really good, so that I was completely ready to go.
Good. That is so important because the set and setting is what makes you have a good experience. If people come into this and they don't really know what to expect, that's kind of what you're going to get out of therapy. So we really want people to know, I'm going to be lying in this room. We know what room we're going to be in. I have a blindfold on. I'm listening to this music. This is, at the first appointment, Nicole gave you a packet. It's this packet, and it talks about everything to do with the procedure, and it has the consent in there, which is very long because it has a lot of information in it. And so we give that right away because we want you to have ample time to read through that, understand, the possibilities of what could happen, what might happen, and what we do to mitigate any kind of adverse events. At that set and setting, then, the other things that happen is not only you and how you're going to be, but then the consents of, do we want therapeutic touch? So therapeutic touch is like, you're okay. And so that is a consent that's given prior to the administration of medication, because once you're in the state of that sub-anesthetic place that ketamine takes you to, you can't give consent any longer. So all of that has to get established prior. Also, then there are kind of ground rules, like you don't eat for 4 hours before. Nicole does give you a snack directly after, and some water, whatever people like. And understanding that the infusion is going to be an hour, and then there's a 2-hour period after that is just a period for you to absorb, rest, relax, and get back into your own mind. And so with that infusion, obviously that's a medical procedure. I am mixing the ketamine. I'm the only one in the clinic that does that. And so it's weight-based and also based on what the patient needs. So we start with a smaller dose, and we do work up to a slightly larger dose. But again, totally dependent on the patient. I mix that, we carry it in there, and I start the IV, and then you have that hour-long experience. And tell us about that.
Well, it started immediately, which was really nice because I didn't have to wait for it. It just seemed like as soon as the IV went in, I just went into a very relaxed state. I just felt this incredible feeling of happiness, and I felt like I wasn't really having visuals, except for I was having this kind of feeling that I was out into the cosmos, and there was this kind of being out into the universe feeling, but it wasn't like airy, it was more like dense, and but I was just feeling so happy. And I was enjoying myself like incredibly.
That is great.
And there was this experience that I was having of feeling like all the cells of my body were being washed in the ketamine. It felt like I could feel my brain being washed and my cells being washed. It felt very deep and very therapeutic. I could feel this trust in the medicine, like really trusting what was happening. And this washing that was going over my whole sense of self. And it was incredibly pleasant. In fact, I was concerned that I wasn't struggling like I'm just having such a good time here.
This needs to be work.
I should be working right now. And then I would say, there was very few words in the experience, but I felt like, no, just go with it. Just surrender to the experience. You don't need to make an experience.
Right.
Just surrender to the experience that you're having. And so it was incredibly lovely experience.
That is wonderful.
Yeah, and it really was the after. I was surprised at how much benefit I got when it was over. I didn't know that it would work me. Like it really did work me for a good couple weeks.
That is amazing.
Yeah.
And then tell us, so then after the experience, within 48 hours, Karen came back, as all patients will, to have an integration session with Nicole. And that's where you talk about what was your experience, and then what do you do with that to make those changes in your life? So tell us about that.
Well, I felt like I didn't think of myself, I didn't come into this thinking, oh, I'm depressed, I need help. But I felt like this kind of release that happened to me. Like I felt like I don't know that I was depressed, but if I was, I'm not now. It felt like this letting go of a sense of depression that I wasn't even aware of. I felt this just such a deep letting go in my body and my soul and my spirit, and just this overall feeling of happiness that came over me. But it was interesting because I got into this conflict with my husband, which sounds terrible, but it wasn't. It was like, because my behavior in the conflict was so different, and that was really surprising because I uncovered, and I wasn't looking to uncover, but I uncovered a pattern of mine. Like I realized that my whole life, and you have these patterns from your childhood, you don't even recognize that you're doing these patterns. And my pattern was that I would go into confusion, like if I was having a conflict with somebody, I'd go into confusion, and then I'd go into disassociation. And I was able to watch myself, like there was a sense of space that was created between my reaction. I didn't just react, I had this therapeutic space to make choices. And I saw that happening. Like I could see the confusion and the disassociation happening. And I was like, oh, this is a childhood pattern that I created. And I don't have to do this anymore. And I stopped myself in the confusion. And I just felt this kind of overall emotional kind of resilience that was really awesome, to feel that kind of strength and resilience in myself. And actually have stopped that pattern completely. Like I don't do that anymore.
Wow.
And that affected me throughout all my life choices.
That is amazing. That is so great, because that is very often where we find ourselves, you know, when we're having conflict. Obviously, when everything's going great, there's no problems. That's fine. But when we're having conflicts, and we do all fall into patterns of things, and we often don't resolve those conflicts because we do keep doing the same thing over and over again. So finding that space and being able to say like, okay, I'm not going to do this any longer, will definitely help all of us to have better interpersonal relationships, walk away from conflicts feeling like, okay, this is resolved, it's better. It's not like I didn't get to say what I wanted to say because I didn't know how to say it, or, you know, so it's so good for you to be able to do that. I'm so excited about that.
Yeah, it really has helped change my relationships and just my way of being and just my sense of personal power. And I felt like the ketamine was actually working. It really, I did feel the sense of repatterning in my brain. Like I didn't have to go through and just behave the same way, that there was a newness to the patterns that I'd created. And I could feel it working me for a while. So I really appreciated it. It was, you know, a really helpful and very therapeutic for me, more than I expected.
I am so happy to hear that. It is, oh my gosh, because that's all we want to do here, is help people live their optimum lives with whatever tools we have that are safe and effective for patients. One thing I did want to talk about the experience as well is many people talk about going into this K-hole, which is just like you're out and you're gone. Because we are looking to do therapy here, and we are not looking for people to have this like full-on psychedelic experience, we're looking for a therapeutic experience. We do sub-anesthetic doses here. So very often our patients talk through the sessions, get up and go to the bathroom, you know, a number of things happen. So, you know, people have this image of you're going to get this ketamine infusion and you're just going to be like on the couch. And it's not like that, right? You're there. You can choose to go inward and be there, but you can also choose to go outward if that's what you wanted to do. So that's, a lot of people have that fear that their choice is going to be taken away. They're not going to have ability to control, you know, because all of us are afraid of giving up control. And the ketamine will allow you to give that control up when you want to, for the best for you, but it's not taken from you. And that's a really important distinction, I think, with the ketamine. So thank you so much for sharing your story.
Thank you for
you guys have
experience.
Yes, you're welcome. If you guys have any questions, drop your comments below. Call the clinic for a consultation. We are so excited to work with you.